It's the month of love. Happy new month and welcome to another beautiful new week of Just Siri. I can't wait to experience all the good things which I'm calling onto myself that February has in store. So hello ladies, how are you doing? How was the weekend? Blessings. Let me start with you. Please surprise me.
No, I got nothing.
Oh my God. But at least one thing is sure, that if you had to bet, like if they, you know all those times where they tell you, pick one person you know is not going to pick the phone call. I'm the one who doesn't pick the call. I will answer text message. It's me. But if they tell you, bet who is not going to have any news for you on the weekend, from the weekend, we all point at her. And we'll win 500 million.
No.
Shock fire.
I was shocking.
Shock fire. Who do you want to shock?
No, she actually has news.
She has news because I should turn one.
Yeah.
Oh, you did not do photo shoot again?
No, I didn't. So because I didn't do anything, that's why I don't have news. But like, I handed him over to my facility manager, and I'm like, you know
I
what?
thought you were going to say you handed him over for Thanksgiving, like.
I'm not that dramatic.
Who said you're not that dramatic?
I just said, you know what, gather all the dogs in the compound, in the estate that you can find, and just get them something to eat.
Oh.
You know, it's just with the bills of me.
Yeah, no videos, nothing to show. So
Gen Z, everything.
But the vet sent us a very loving mail. Oh,
yeah.
So that you remind them so that you can come and pay Kini.
Yeah, but he's
okay. He's boring you. He's all right.
Exciting Catherine.
Yes, I. You guys are holding my hand.
No. One day we should flip the script and not come on a Monday and say, how was your weekend? Maybe we should do something different. I just saw a game show. I was watching, not really a game, like it was Q&A during football. It was a football.
Catherine, is that was your weekend?
No,
it's a distraction.
No, it's not a distraction.
Okay, finish.
I feel we should do it. Just do something different.
What's that?
Because someone told me, oh, I'm sure they're going to ask you guys how was your weekend on Monday. I said, wow. That in your mind, you have seen us Just Siri finish.
But it's not a bad question.
No, it's not.
Okay, what was the game show?
Tulemond?
It weekended.
Please, what is Tulemond?
Everybody.
It means everybody.
Like the world, Abby?
Yeah, everybody.
Also, Telemundo now makes sense, maybe.
No.
Telemundo.
You know, I'm so happy because it kept staying in my head.
Television is Telemundo.
No, but all these languages are Latin-based languages.
Wow. And you said that I was what? I was
so sorry.
distracted.
How was your weekend?
There.
I had the most boring weekend ever. I didn't step out of the house.
Exactly.
I stayed at home all day.
Why do you make it seem
Because
as if
I
when you
actually
do
went to an esthetician on Friday.
Esthetician.
Esthetician.
How was it?
Nice. She did take out that thing beside my eye.
Was it a tag or a mole?
Like it's not like a molly, but
that might be a skin tag.
it has some stuff.
So
in
she
it.
used
She injected me with something. Then she used something like a cauterizer. It had like sparks in it.
It's not laser.
Then, no, she used it to burn it.
And then it falls off. So what she did was
use it. Yeah, rub my face with all sorts of things, give me all sorts of rubbies. I don't know, maybe that was what made me, and I started taking some new vitamin regimen. But all those things make you sleep.
Some of them.
Really, Primrose oil?
Some. It relaxes you. Not. Did you put magnesium in that?
No.
Okay, we'll talk about that later.
Oh, I shouldn't take it together?
No, you can.
I wanted to add magnesium, but not yet.
We're all very distracted.
Yeah, so I slept all day. Even on Sunday, I really hoped for something. I don't want to. I'll tell you off camera, but I just stayed at home, joined the service online, and but how many of you? I don't know if it's just me, but the ostentatiousness of church business, it's crawling on me.
It's a conversation for a new day. We're going to get to it. Because we're introducing something. We're going to introduce something. Let's just hold it. Okay, ask me. It's not like, I was no better. I was no better. No, I was no better. Asking you.
I thought I was going to enter February.
Hold on. Really? No better than this one, this one, and this one.
So explain what all the same thing.
No, I was in the house.
Would you believe that my children ate my cream cheese that you gave me?
I'm so sorry.
They used it to make fast spaghetti. Yeah. And I kept looking for it in the freezer. All my hands were frozen.
Cream cheese that they sent from abroad.
I swear. Murewa. That's why we're punishing him. No allowance until 5th of February. Yeah.
So the only thing that happened was I made onion butter rice with blackened Cajun fish.
Can't even picture what.
Everybody just
Don't worry,
open
it's
them
fine.
up. I'm a
understand. And you have the gumption to sit on this table without bringing
onion,
plates.
butter, rice. You put a lot of onions in the rice, then you put butter in it.
And then you fry it with turmeric and seasonings. It's like the base for fried rice almost. But please, Catherine, we need to continue on.
You keep saying it's here. And yet she doesn't bring, I said we should have breakfast.
I'm always swallowing saliva.
You understand?
Onion, because I'm an onion fan.
Clock is counting down. Guest is standing by.
I wish I had to say
Koda, yeah.
Koda.
yes.
Koda.
Koda rara o Tolu. God is watching you.
Let's go.
Ọlọ́run wò.
Ọlọ́run Tolu. Koda rara o Ọlọ́run wò.
Wò.
Ọlọ́run wò.
Catherine.
Catherine, go on before you start speaking in tongues.
All right, so since the surprising surprise on the table today, we got one beautiful one from our very own Temilade Openi. My girl Thames, as she won the Best African Music Performance category. She won that at the 67th Grammy Awards. Guys, did you see that? Her hit song Love Me Jeje has fetched her second Grammy after beating songs like Tomorrow by Yemi Alade, MMS by Ashake, featuring Wizkid, Sensational by Chris Brown featuring Davido and Lojay, and Higher by Burna Boy. So Thames received 3 nominations at this year's Grammys. That brings her career total to 8. She was also nominated for Best Global Music Album, Born in the Wild, and Best R&B Song, Burning. So congratulations, Thames. Thank you for bringing this one home. We here on Just, we are so proud of you. It feels good to start with some good news on a Monday.
It's good. I love that.
Proud.
I feel so good.
It's a girl season. Woo!
I'm happy for Thames.
I'm happy for
Actually,
them.
and so much happened this weekend. But
Did you see what they wore at the Grammys, though?
Yeah.
The
fashion?
Not dear Thames. Did you see the fashion at the Grammys?
No, I saw Yemi Alade's.
Not even Nigerian. Let's go
Beyonce. I saw
global.
Beyonce.
Global.
Did you see
I didn't.
Kanye? Did you see the Smiths?
His wife.
I didn't watch it.
You didn't see the Smiths?
No.
Willow and Jaden.
That wore her house on his head.
And what did Willow wear?
She wore black. She was actually quite understated.
No. Did you see what was under?
Blessings. Blessings.
Yes.
What was under?
Blessings.
Okay.
Read
All
the
right.
script.
So much happened this weekend, but one can only bring you one. Now, an update to a story that went viral in October 2024 has left many shaking their heads. Now, the story was about an angry girlfriend who poisoned her ex and 4 of his friends, or allegedly, with 1 pot of pepper soup, which led to their deaths. Turns out she was falsely accused and wasn't responsible for their death. As a matter of fact, she never even cooked pepper soup. She wasn't even in the area. So how did this news spread in the very first place? Now, here's a story. Aisha Suleiman, who was accused of poisoning 5 people with pepper soup at the time, has spoken out after investigations revealed that the victims actually died from inhaling generator fumes. In October 2024, Suleiman was nearly lynched when the social media user on X shared her photo, accusing her of poisoning her boyfriend and 4 of his friends. Despite not being in the area when the incident occurred, she was confronted upon her return, publicly humiliated and tied up by enraged community members who doused her with petrol and were ready to set her ablaze, of course. Now, authorities intervened just in time to save her life. She was subsequently arrested and charged in court. However, human rights activists got involved, leading to a proper investigation that now revealed the true cause of death was carbon monoxide poisoning from generator fumes.
Now, speaking in an interview after her exoneration on Friday, Suleiman denied ever cooking pepper soup for anyone. She explained that tensions arose after she ended her relationship with her late boyfriend, and his father barred her from visiting their home. On the day of the tragic incident, Suleiman said she was in Iyakpi, while the deaths occurred in Afashio. Now, many are calling for legal action against a friend of Suleiman's late boyfriend who raised the alarm. And really, I cannot begin to imagine what she has gone through and what her family has also gone through as well. It's a very tragic case. And when we read all these stories, people seem to not remind us that she's 16. She's actually 16. The boyfriend was 19. I'm not talking about their age difference.
Yeah,
but we keep telling the story like she's a grown woman. she's actually 16. And
she was almost lynched.
And she was almost lynched.
burnt to
So the
death.
police rescued her, took her to court, and because she was 16, they couldn't put her in prison. They put her in a welfare facility, and they charged her. And it was because of the noise that some people were making that her lawyer, who apparently is like a human rights activist, got involved. He demanded further investigations, and that's how they found out that, one, she was not in the area, there was never any pepper soup cooked, and that they died from generator fumes. What?
Are we not even thanking Almighty God on her behalf that a human rights lawyer intervened and they did proper investigation? Sometimes when I say that, when our security agencies want to do their job, they do a fantastic job of it when they want to. Imagine they never found this out. She would wonder all her life,
probably,
whatever happened.
And I'm glad
why is she in this state?
I'm glad they took it up this early, because we're so used to hearing, 20 years later, somebody decided to take up her case, and then she would have been in
the later part of her life.
I think also the human rights activists also, I think they focused on this matter, and I think they also assisted in putting pressure on the authorities to also, don't let this thing just die. Let's see it from beginning to the end, and I think that's why they came back with that result. And I'm happy to know that finally, I'm sure she's thinking, oh my God, finally, it's what I've been saying all along. Because Nigerians can just come and say, sorry now, say, and
so what should we do to the person that started out?
So the family said they are planning to institute a legal case against him. Because his initial pointing of the finger and using her pictures is what community members took up when she returned to the area. And I'll also use this, I know a lot of people don't like it, but I'm an actual proponent and fan of autopsies.
Yes.
I do not think that in this day and age, people should die if it's not an accident, if it's not a clear kidney, and there's no mark on them without you ordering or asking for an autopsy. I think of it in cases like this, and then I also think of the fact that there are many of us walking around with inherited or what do you call it? First, there's a word for it, but genetic disorders that run in the family. Somebody will slump and die. You're not going to do an autopsy. You don't know if it's something that another family member, if they find out about, can help to prevent early death. I'm a huge proponent of autopsies. I know they're not necessarily cheap, but I think they can make sure the air is cleared, and you don't always carry a sort of question of what if, or is there something we didn't know?
Even if it doesn't involve someone else that's been accused, you just knowing gives you that closure. Okay, this person did. Because a lot of people say maybe a man leaves his wife at home, and then you will now be thinking, oh, I should have been with her, not knowing that whether or not you were with her, she would have died.
Yes, and then let's go back to this mob justice, mob mentality thing. It's just, hey, Ole, and the next thing you know, everybody's coming after you. The Nigerians become judge, jury, and executioner.
And they don't even ask questions.
They don't ask questions. People tend to say sometimes it's because there's a lack of trust in the criminal justice system, that they've seen too many people arrested for crimes, and then you see them back on the streets the next day because somebody. But that is not. We have had too many. I'm so sorry. We've had too many stories of innocent people caught up. It could be your family member the next day. Don't be so quick to raise a stick, to get a tire, to bring the foil.
I said, okay, when you burn and lynch a person, how does that make it justice for you? That's turning you and the people that perpetrated the attack and animals, and you should be prosecuted.
I think first
because
of all,
it's not in your right to kill anyone.
In Nigeria specifically, I think we react very emotionally.
Yes.
First of all, without thinking, you react emotionally. And I ask people, put yourself in a situation where, if you were in your house and burglars come to your house, will you quickly open the door? Will you quickly go out because you hear they're burglars? Sometimes count up to 10. Take a pause. Step back. Forget that, that hound, everybody's angry. We always make a joke of it, our blood, they hot for these people. And we just run before thinking. I think once we can intentionally slow down before we react to everything that comes our way, then we will be able to actually breathe through all of these.
We hear go, we never hear come.
We don't hear come.
Nigerians don't hear come.
And they don't investigate anything.
Imagine if that girl had lost her life, she would she had died.
And then we still found out that it generated. And so one of the tweets that first came out about her and the pepper soup, unfortunately we're having some technical errors, I apologize, 7.9 million views. So that story went, it was gone. Her videos were everywhere. She was tagged as a murderer.
Yeah,
people don't even use alleged. Not everybody on social media. Not everybody on social media
has done to her
mentally.
Her business, her network, her social life, everything. You know, listen.
Pepper Soup of 4 of his friends,
A year
7.9 million views.
Do you know what she has lost that can't be quantified?
And
apart from her mental state. Listen, friends, you know how we're quick to remove ourselves from.
Yeah, and you know this thing on social media that everybody, you are not an investigator,
so
you are not a journalist, but you want to be the first to break a news.
So that's the disaster.
Something you do not know.
The lawsuit is when we start suing them.
Yes.
The issue of citizen journalism, and unfortunately, individuals are more likely to believe these bloggers than even the news that carry. You see, news stations will say, "Oh, allegedly she didn't
They'll be shouting, "Why are you saying allegedly?"
You're trying to cover up for it. No investigation done, nothing at all that points to the fact that okay, she actually did it. She did. There was no confession from her, and yet
apparently one of the father of one of the late boys that died even said she wasn't in the area. But it wasn't enough.
Serious.
Guys, we'll come back to this because
this is yet another wake-up call for all of us, to be careful with the stories we see on social media. It could be us or anyone we care about. For people like me, it reinforces why I believe that there should be some sort of level of social media regulation. Honestly, I believe it wholeheartedly. I'm happy to hear that our family plans to press charges against this person who posted on social media with the claim. Anyway, let's leave that for now. When we come back, we have a very distinguished guest joining us, Professor Oyewole Tomori. He's going to be joining us to look at the improving Nigeria's HIV/AIDS outcomes. Please stay with us.
All right, welcome back to Jasiri. Watching us live on all our socials. Please do well to tune in and join us. So last week, the global health sector was thrown into panic with the news that US President Donald Trump had signed an executive order to pause nearly all global health funding from the US, and that included PEPFAR, the President's Emergency Plan for AIDS Relief created by President George W. Bush in 2003 to prevent HIV and AIDS. With its $6.5 billion annual budget, PEPFAR provides HIV/AIDS medications for over 20.6 million people, keeping patients alive, preventing them from transmitting the virus. So according to a US State Department fact sheet, PEPFAR has saved the lives of an estimated 26 million people since inception. And one of the countries that has benefited has been Nigeria. Nigeria has made significant progress in combating HIV/AIDS, the pandemic, and largely due to strong partnerships and sustained investments. Despite these advancements, Nigeria continues to face significant challenges. With around 1.9 million people living with HIV, the country bears the 4th largest HIV burden globally. Shortly after a US federal judge granted an order temporarily halting the freeze, Trump reversed his order.
Now, according to the Director General of the National Agency for the Control of AIDS, NACA, Nigeria recorded an alarming 1,400 new HIV infections and 50,000 AIDS-related deaths weekly in 2023. However, notable progress has been made in treatment access, with 90% of people living with HIV aware of their status, 98% of those diagnosed receiving antiretroviral therapy, and 95% of those on treatment achieving viral suppression. Now, these achievements demonstrate Nigeria's success in expanding HIV care and reducing transmission risks, though sustained investment remains critical. But Trump's initial decision to freeze global aid is leading many countries, like Nigeria, to reassess their ability to handle issues like HIV/AIDS, malaria, tuberculosis, and more on their own. Now, joining us to discuss Nigeria's HIV/AIDS response and the road ahead is Professor Oyewole Tomori, a distinguished virologist and global health expert with extensive experience in infectious disease control. Professor Tomori, thank you so much for your time today.
Thank you very much.
All right, Professor Tomori, let's start with a look at what might have happened. And I say it's possible, still possible as long as Trump is president, if he had not reversed the funding freeze. Now, the executive order that Donald Trump signed was to halt virtually all U.S. foreign assistance for at least 90 days, pending a review of all programs. If that had gone ahead, what impact would a 90-day pause on funding have had on Nigeria?
First of all, I'm quite excited to be amongst amazingly beautiful women that I'm looking at from the screen.
Oh, thank you
for inviting
sir.
me.
Thank you, sir.
Secondly, you are calling me today, which is also my 79th birthday.
Happy birthday!
Happy birthday, sir.
You don't look anything like 79.
Go ahead.
Yeah, thank you very much. I'm actually in a hotel in Abuja at the conference. So I'm just coming back to take this program. And then I go back to the conference.
Thank you.
But let me talk about the HIV situation and what Trump has done. For me, in spite of whatever anybody says, I think it's a great thing. You may wonder, why am I saying that? Yeah. It's nothing new. When he came the first time in 2016, he did the same thing. We drew from WHO, and not about it was the new president that rescinded that. So we expected it when he came back. We should have been prepared for it. And a country like us, who gives us the aid? We give the aid to ourselves. Why are we waiting for outsiders to help us take care of the AIDS? When we make our babies, we don't call the international aid. When it is time to take care of them and give them vaccine, we start begging for aid. So a time has come when we should begin to look at situation in disease. If we cause a problem for ourselves, let's get on and solve a problem ourselves. We can get assistance, but the initial activity to take care of it should come from us, not depending on what Trump says. And countries that know what they are dealing with know what to do. See what Canada has done to all that America is doing. Why can't we do the same? Because we misspend our money. They call us resource limited. We are not resource limited. We are resource wasteful and resource squandering. And that's what has put us in the position where we are begging. And when Trump sneezes in America, we start catching cold in Africa. That's not what it should be. Time has come for us. 60-something years of independence. We're still depending on other people to take care of our problem. So while what is done in 90 days is going to have effect on so many people, the better it does. Maybe that will wake us up to take care of our problem.
Very interesting, sir. Very interesting angle. A spokesperson for the U.S. State Department is quoted as saying the U.S. is no longer going to blindly dole out money with no return for the American people. End of quote. Saying the pause is a moral imperative. Many people think there is a potential for a scale back in funding. This leads me to ask where we stand on domestic funding of diseases like HIV, AIDS, malaria, tuberculosis, and others. You know, Nigeria has grown comfortable over the years. We were, waiting for these aids to be able to put programs in place to be able to hold back some of these diseases. What kind of outlook does domestic funding look like for us?
I thank you very much. And I started by saying we as a country are not resource limited. We waste our money. We don't put enough money into health. We spend our money on frivolous activities. Let me give you one little example. When I was growing up, I told you I'm 79 years old, we had in this country, at local government level, at state level, what departments we call epidemiology departments that looked after diseases. When a disease outbreak comes out in my grandmother's village, somebody was there at the local government to go and look at it. The same thing with the state. They had the vehicles, means of getting in to go and investigate. Today, many of the states and local governments have abandoned that one. Everybody is depending on National Center for Disease Control. And what are they controlling? They don't even have the resources. While an institute like a state EP division doesn't even have a bicycle to go and investigate something, my president will go from the airport to his house with 20, 30 cars entourage following him. And you're saying we're resource limited. These are issues that we need to be addressing. These are the things we need to put your money where your mouth is. The AIDS that we are getting is not caused by Trump. It is what we do within our own activities. So let's put our money there. And look, decentralize our National Center for Disease Control, bring the whole thing back, bring the disease control down and decentralize it to the local government level so that they can take care of it as it comes to this thing. When anything happens in my mother's village, which is 400 miles from Abuja, I call NCDC to come and solve the problem. By the time NCC wakes up and does that one, virtually everybody is dead in my village. That wasn't what we were doing before. So what are we doing? Why are we begging for all those things? And when you check the ESCC website, among the governors that have passed and what ESCC is taking to court over money that they have stolen, add up all that money, is much more than what the USAID is giving to us to solve our problem. That's number one. And this aid thing we're getting, when they give you aid, 60 to 70% goes back to them in one form or the other. The people who are actually more complaining about all these things are those who are holding those positions. The jeeps they ride around, the whatever special thing they get, that's where most of the money goes.
All right, so Professor Tomori, so this situation now requires a review of where Nigeria stands with HIV and AIDS, with a 28% reduction in new HIV infections since 2012 and a 73% reduction in AIDS-related deaths since 2002. So Nigeria has made significant progress in combating HIV and AIDS, particularly in increasing treatment access. So what would you say are the key factors driving this success?
First of all, like you said, the USAID intervention and other countries, not just USAID alone, assisted us in this. And what they were doing, they counseled people, they provided diagnostic for whatever, they provided medicine to treat the people, they make sure that mother-to-child transmission is halted. Those are the who contributed to those reductions we're getting. And how much did they spend? $600,000, I think they said they spent in 1 year. That's about $1 billion. That's maybe, is it that we can't get that $1 billion in Nigeria, naira in Nigeria? If we order our priorities, if all those are collected at the National Assembly, or all the money which they are squandering and being in community services, if we revert that to what the USAID is giving to us, we'll continue the same thing. But we're not going to do that. We'll continue squandering, and the cases will continue to come in. So what we need is to reorder our priorities. Look at where the problems are and transfer the money to those places. You remember when COVID came? Yeah. We borrowed about 500 billion. I can't remember how much we borrowed. How much of that money went into COVID? 25%, 75% of them went into other things which had nothing to do with COVID. So we have the money. Let's not deceive ourselves. Yeah. Either we borrowed it or whatever, or the existing place, we have the money. But half of the 3/4 of the money will go into somebody's pocket, not to solve the problem that we're doing. So let's not go around and say, yeah, oh, they're going to cause this. Yeah, they will. There'll be a problem. But when you wake up, you have a problem in your house, you revitalize. Listen, if your children must go to school and you have to pay your school fees, you forget the shoes you are going to buy. You forget the new clothes you're going to buy so that your child can go to school. That's what we need to do at this time.
That's very spot on, Professor Tomori. And talking about that gap and, of course, the bottlenecks that we experience and priority. Now, despite Nigeria's progress in combating HIV/AIDS, the country still, unfortunately, grapples with alarming rates of new infections and AIDS-related deaths. We're talking 1,400 new cases, 50,000 deaths reported weekly. That's as of 2023. Now, to better understand the root causes of these persistent challenges, what do you think are the critical gaps in prevention and treatment strategies that need to be urgently addressed or need urgent attention and addressing?
Thank you very much. The guys who are in charge of HIV/AIDS and other things, they have all this data. They know where the problems are. It's not that information is something new. It's the data they've been collecting over the years. And you know, if they put the right amount of money, they've done it with USAID, with PEPFAR over the years. So they're experienced. They have all the experience to do. It's just enabling them to continue what the funding was doing. It's not Trump who's bringing the experts. They're Nigerians like you and I. There are people who have gained experience over the years. All we are asking our government is to create an enabling environment for these people to function. When people go out into diaspora, the reason they are going is because the environment does not enable them. It curbs their ability. And then we're dreaming that those in diaspora will come back. Come back to what? You have not improved the condition that made them to run away. It has even gone worse and say you're coming back. Address the issue at the beginning. Create that enabling environment with the resources you have. You have the talent, you have the people. Give them the wherewithal to do what they need to do. That's what we're asking. And that amount of money, when you invest it, is much costlier than what you if the epidemic rages. If your disease surveillance works in place and you have the things done the right way, then of course you won't have the large number of cases you are treating with. That's the basic thing. I mean, and it's so much cheaper to do that than to wait for donation to cure people who are already going to die. How much money do you put on somebody's life?
Wow, that's really hard eating, and I'm hoping our government will take a cue from some of the discussions we're having this morning. All right, let's talk about lessons and preparedness. When the conversation continues here on Jasiri, we'll go for a little break. When we return, we'll talk more on the issue.
Many thanks for staying tuned. You're still live with us on Jasiri, and today we're looking at improving Nigeria's HIV/AIDS outcomes. Now, this conversation became necessary after the moves that the U.S. President Donald Trump made to pause global health funding from the U.S. Now, while he has reversed that decision, it seems to have put many countries that benefit from that aid on notice. Professor Oyewole Tomori, a globally respected virologist and former president of the Nigerian Academy of Science, who has years of experience in disease surveillance, public health, and vaccine development, has been helping us to unpack whether Nigeria is truly prepared to handle its disease burden independently, or if we're dangerously dependent on foreign aid. Thank you so much for still being here with us, sir.
So, thank you so much, Professor Tomori. We can talk about Nigeria, and I think many people would have been surprised with your answer early on that you said it's a good thing that Trump did, because it's basically about weaning us from the dependency that we have on foreign donations. But it's a very staggering situation that could have happened. Now, in the meantime, in that just about 48 hours between when Trump announced signed the executive order, a court temporarily halted it, and then he reversed his executive order. In Uganda, the National Malaria Control Program had suspended spraying insecticide into village homes and ceased shipments of bed nets for distribution to pregnant women and young children. Medical supplies, including drugs to stop hemorrhages in pregnant women and rehydration salts that treats life-threatening diarrhea in toddlers, could not reach villages in Zambia because the trucking companies transporting them were paid through a suspended supply project of the United States Agency for International Development. Dozens of clinical trials in South Asia, Africa, and Latin America were suspended. Thousands of people enrolled in studies have drugs, vaccines, and even medical devices that were in their bodies for that short period of time that had no access to continuing treatment or the researchers who were supervising their care. We understand the idea to remove the funding, to remove our dependency, but there are serious real-life, real-world consequences. If funding is cut, what specific steps must a country like Nigeria take to ensure that we are ready, that we're able? We can talk about those at NACA, having the data and knowing where the gaps are, but in all honesty, sir, with the years of experience you've had, what are the critical steps? Because as I said earlier, he's still going to try something. This is Donald Trump we're talking about. He tried this way, maybe it didn't work. There are 4 years of this presidency to go. I expect to scale back in funding or another attempt to again halt it. We've seen the writing on the wall, as they would say. What are the steps Nigeria should be taking from here?
Thank you very much. When you see the writing on the wall, you take the action to solve that problem. This is not the first time we are having intelligence agencies threaten us. It happened to us during COVID. It happened to us in so many other places. Take monkeypox, for example. The world did not declare a problem until it got into Europe. It was in Africa for more than 50 years. Nobody talked about monkeypox. So we have enough reasons and lessons to learn from the past. It's just that we are refused to learn our lessons. They've done it to us before. They will continue to do it to us, whether we like it or not. It's left for us to make up our mind to do what we need to do. So don't tell me, you remember during the apartheid time, they were saying, oh, they shouldn't sanction South Africa because it's the poor of South Africa that will suffer most. But at the end of it all, they were suffering. Yes, we are suffering now. A country that knows what to do will wake up and do the right thing. You know, all the things we're blaming the West for, oh, they are holding vaccine, they are holding this. The question I asked our people then was that, suppose situations were reversed. Suppose it was Africa that everybody was dying of COVID. Suppose it was Africa that discovered the vaccine. Suppose it was Africa that bought the vaccine. And Europe, which wasn't having cases, now wanted the vaccine from you. Will you give them? No, they said they wouldn't. So why are we complaining about what they're doing? They're taking care of themselves. We should take care of our people. Is it that we don't have the resources? I keep saying it. We're deceiving ourselves. We say we don't have the resources. We are just wasting our resources. So what do we need to do? Reorder your priorities. After all, if an emergency comes, the federal government will find the money today. This is an emergency. I don't think, even if I pray Trump doesn't go back and continue after the 90 days, let him continue. I pray he doesn't. It is time for us to wake up. I mean, this is not the first time this has happened. Why are we now pretending as if it's something else? That's the same thing that happens in your country. Every January, Nigeria sets up task force to look at Lassa fever. We have been doing that since 1959. Why are we not learning our lesson? These are the issues. So I pray Trump doesn't rescind what he's saying. Let us wake up now, reorder our promises. But a few of the cars that my president and other people have, sell those cars and all the luxury they have, and let's put this money to solve this immediate problem. This is an emergency in our hand. Let us put our money where the emergency is.
All right, Professor, I'm very inclined to go with your thinking. I like it because you've made such strong points. But let's look beyond funding. In this moment, Nigeria's health system has deep structural weaknesses. There's poor infrastructure. There's the brain drain of medical professionals. There's the weak disease surveillance. And so many more. But what are the key areas we must urgently address to strengthen our response to future outbreaks?
The first thing and the most important thing is to create an enabling environment for the human resources that we have, and there are quite many, to function. That's all. People of my generation never left this country because the environment was there for me to do the research or do the work I wanted to do. That's basically where we stayed. I love my country. I keep telling people that I owe this country more than I can ever pay back. Having gone from a highly polygamous house, 39th child of my father, going to primary school in my village, secondary school in Delta, university in Zaria, all free. That was the country I lived in. That was the environment that kept people like us here.
That's nice.
So why can't we go back to those? The people who did in those times, the Ebola was, they didn't have two heads. So what's happening to the leaders we're having today? We didn't have the oil in that time when I'm talking. It was cocoa here, granite up there, coal in one place. But we managed our resources well. We can do the same thing. Go back to those and make sure, create that environment for this experience. Tell me about disease investigation. Who has my experience? Is it the man from America that has experience on investigating disease in Nigeria than myself? I've been at this job for the last 50 years. Then you bring one neophyte from America to come and teach me how to investigate disease in my mother's village. Give me the amount of money to do that work, and we turn this country around. That's what we're asking. Wow. Forget all these donors and all this nonsense. Bring the money, create the environment, and the talent we have in this country will solve Nigeria's problem.
Professor, good morning, sir. You came in with God's blessing this morning. You are taking off all the table, you are taking off the table, the stands on the table this morning. Well done. Professor Tomori, please, let's shift gears a little. Shortly after Trump initially announced the pause in the global health funding, he announced that the U.S. was pulling out of the funding for the WHO, that's the World Health Organization again. Trump has long been critical of the United Nations Health Agency, and his administration has tried to pull out in July 2020 as the COVID-19 pandemic continued to spread. But Biden halted that. The executive order on this cited the organization's mishandling of the COVID-19 pandemic that arose out of Wuhan in China and other global health crises. His failure to adopt urgently needed reforms and his inability to demonstrate independence from the inappropriate political influence of WHO member states as reasons for the U.S. withdrawal. How do you think that this will impact the world health, and particularly the global south? You know, we have a lot of dependence on WHO. What's going to happen if this bad thing happens to them eventually?
What's happened?
First of all, all the things that Trump is saying about China, all those, they're all excuses. They run the World Bank. You'll never find another person chair the World Bank. Europe takes the IMF. So they've distributed all those things. We are just deceiving ourselves to think we are part of the world. Yes, we are in charge of WTO. Tedros is in charge of WHO. But who runs WHO? Who runs WTO? We are just there. We are just figurehead. That's what we are. When it comes to WTO and W whatever, they do it by consensus. When it comes to the United Nations, they do it by veto. So it's all a deceitful world we're in. So let not Trump give all those stupid excuses that he's giving. We know. But it's for us to make up our mind where we go. And when you have your money talks. We talk about equity. There's nothing like equity, forget it. When from foundation of nature, there's nothing like equity. God created all of us equal, Abi. But God has his anointed. And there are conditions to become the anointed. So let's forget equity. Forget equity. We need liberation. Liberation of our mind, liberation of our resources, into do the right thing, this thing. So your question, yes, it's going to make an immediate effect. US contributes about 15-20% to what is this thing. But then when you look at this, I worked in WHO for 10 years. All these donations that we get, the Bible said it, the man who gives you the benefits more than the one you receives. All of the donations that we get, 60-80% of them goes back to them in one form or the other. So let's don't look at it, let's not deceive ourselves. The immediate effect is going to affect, yes, no doubt affects anything, but it is also a wake-up call for WHO to reorder some of the wasteful things that we do. It's also a wake-up call for us in our country to look back and learn from the lessons of the past, to reduce our wastage on all those things. We will suffer immediately, but if we don't do it, we will suffer forever. If we do it, we will suffer briefly for now. Then in our own sustenance, we stop that suffering. See what in South Africa. Supposing apartheid that remain there for lots and this stuff here, people will still be suffering. They are still suffering, but at least it's not like what it is. So let's not be deceived by the fact, this is going to affect. Yes, it will affect. But then it's temporary. Wake up and do something about it and stop the affectation. If I have a problem in my family, I'm not going to call the local government to come and solve it out. I will look for it and suffer it and make amends. These are the things we need to do in our different countries.
Right. Okay. Professor Tomori, this one is quite loaded, but please stay with me because I'm very concerned and curious as to who plays a major role in coordinating global efforts against diseases like malaria, diseases like polio, and the likes. Now, without the U.S. funding, could we see setbacks in Nigeria's progress against these diseases? Because many African countries, including Nigeria, rely on the WHO for technical expertise and emergency health response. So can Nigeria realistically step up to fill this gap, or would we see a collapse in certain health programs?
No, I mean, when crises come, everybody wakes up and does what it is. I don't see us collapsing. We're going to have a little bit of problem. But our government has to have sense of, they have to make up their mind that this is an emergency. We've had emergencies in this country before. We've dealt with it. I see this as an emergency, not just for Nigeria, but for other African countries. And when you have an emergency, you do what you need to do to stop that emergency. Not only that, you continue to do what you need to do so that the emergency does not return. And that's what we need to do right now. Forget all the things about what the immediate problem. Yeah, we're going to have some immediate problem. But then what do we do? Like I keep saying, if you have a problem that you need to sort out, if your tap in your house is leaking, you have to do something, and you look for money to stop that, or else you'll be flooded. So we have an emergency in our hand. Let us put our money where resources is. Go and look at some of the budget. Again, we see it daily. I'm reading in one day where in some of the budgets, we are putting road construction in my Ilawegiti under the budget of the University of Gusau. Those are the kind of things we need to address, to look at, curb all those nonsense that we're doing, all the fraudulent things that are going on, put our money and resources into what we actually need. So let's get out of this nonsense about dependency. We are richer than many of these countries. And you know, my talk to all those people, I say, stop helping us. Your help is toxic. And back to what we're saying, when you hear WHO, World Health Organization, WTO, you think the W stands for what? No, the W there stands for White Health Organization, White Trade Organization, we are not part of their calculation. We are passengers and passers-by. Time for us to wake up and get our things done.
Professor Tomori, I don't know what other things to say after this, but I have to say a very big thank you, because you've really come into this conversation ready and willing to take it to where it needed to go. And it's very obvious that many like you who've been in this in the sector and industry for a while are tired of the status quo, and we're using this situation with Trump as a wake-up call. We want to say a very big thank you to you, but before you go, we need to say happy birthday! Happy birthday! 79 strong, please. We pray that you continue. We pray that you continue to keep this strength.
You have made my day.
Oh, thank you so much. And we pray that you continue to have strength to fight the fights that you're fighting, the fight on all of our behalf, and for the future of Nigeria. Thank you so much, Professor Tomori, for joining us today.
Thank you.
Thank you.
Wow.
Thank you very much. Thank you.
What a very interesting conversation.
He came out, he did.
Because it's like we're being breastfed at 65.
And we ourselves do not want to win
and
ourselves.
we don't want to win. You know, this thing is a dangerous thing, honestly.
Absolutely.
Imagine that Trump did get his way with some of these reforms he's making. What do you think is going to happen to us?
He's still going to try. Polio. If you think that is the end, we're deceiving ourselves.
Things like polio, we have become so dependent. Tuberculosis, we have become so dependent that we don't have plan B.
Yes, and we're very vulnerable because of our environment, basically. So we'll have a health crisis.
We'll have a health crisis.
We have an artificial health crisis. We are the ones that have decided to, because the professor kept saying it over and over again. We can't do this if we want to.
We are
wasteful. We are wasteful. We are greedy. Cut down things. We don't need assistance from the West. We don't need it. And the WTO and WHO, prof.
It stands for what? That was.
He went to town.
Shots fired, as Gen
Shots
Z
fired.
millennials. And that's a wrap on this episode of Jasiri, the first Monday of February 2025. Now, as we step into this new month, let's remind ourselves that every day is another opportunity to push forward, challenge the status quo, and create the change that we want to see. The conversations we have here aren't just words, they're fuel for action, for awareness, and for building a better future. We'll see you tomorrow. Please remember to stay part of the Jasiri community. Stay bold, stay fearless, stay Jasiri. Have a good day.